Pinguecula is this little yellowish, brownish, sometimes reddish elevation in the sides of the eye at 3 and 9 o'clock in the eye, in the inner corners and the outer corners of the eye, and it's caused by sun exposure. It's an actual tissue elevation so disfigures a little bit the appearance of the eye. There's nothing you can do to remove it medically. There's no drop that will make it go away. The only way to do it is to excise it and put a little patch graft of tissue that has never been exposed to the sun. The issue with this surgery, and the reason most doctors never perform this surgery, is because it's purely cosmetic surgery. And frankly, there are very few or none areas of the face that are more important than your eyes in terms of cosmesis. So when you decide to do this surgery, you better know what you are doing, and you better know that the patient is going to look better after surgery than before. I have, because of my experience of removing pterygium and doing thousands and thousands of these pterygiums, I've become comfortable and confident enough with this procedure that I can do it, I feel comfortable giving the patient this surgery and removing it and making it look better. So pingueculectomy is something that I perform in selected cases with patients that understand what the procedure is all about, and it's actually a very good cosmetic procedure for some people who don't like those little yellow elevated spots in their eyes. Well, in reality, you can go back to work next day. It's a local procedure. It's done with drops in the eye, and maybe the day after surgery you feel a little burning, a little pain, but the vision is never really blurry, even the day after surgery. But certainly 2 days after surgery, you can go back to your work. The eye is going to look red, and it's going to have a little scratchiness, but you can go back to work 2 days after surgery. Never had any patients that didn't look much better after surgery than before surgery. I want to give my patients 3 things. I want to give them the very best eye care in the world. We want to produce medical and surgical results, and we produce medical and surgical results that are world-class, that I could have any ophthalmologist from any place in the world come and see our results and realize, doctor, how do you do these? That's fundamental. The second thing I want to do these with a loving, kind touch, with love, with touching the patients as a soul and as a spirit, not just their eyes. And the third thing, I want to do this in the most efficient, pragmatic way there is, so that there's no waiting times, and the answers of the telephones are answered quickly, and the entire experience from the logistical standpoint is beautiful and it's modern, because most of our patients are busy people. They want to have the best eye care with the best love, but done very quickly and out of here. That's all I want to give to my patients, and frankly, we do that very frequently, and we're pushing to do it more consistently.